Hello, Namaste viewers. Welcome to our channel PhysioHealer. Today's video is about what to expect on the road to recovery from brain stroke. What does it look like when someone is improving? Are there any signs of recovery from stroke that you can look for? This video will shine some essential light on some most common signs of recovery from stroke and what is your role if you find that the recovery has stopped or regressing along the way. It is very common for physiotherapists to hear the question from patients and families that how long will it take to get better? Or if they are working, then they will ask, will I be able to go back to my work? Or will I be able to walk again? In fact, it is the first question they ask when we first meet them in outpatient department. Answering to the question to how long will it take to get better and predict the exact duration is always difficult. And you may get vague answers from your therapist due to the fact that recovery time after stroke is different for everyone. As it was mentioned in previous videos of stroke rehabilitation series, recovery is fastest in first 3 months and after that patient will improve but slowly. Study done by Stroke Recovery and Rehabilitation Roundtable Task Force proposed that the first 24 hours is the hyperacute phase, the first 7 days as the acute phase, the first 3 months as the early subacute phase, 4 to 6 months as the late subacute phase, and from 6 months on as the chronic phase. The reason behind this differentiation is that recovery related process for stroke are time dependent. The proportional recovery rule assumes that patients can on average improve around 70% of their lost function to normal or near normal within 3 to 6 months after stroke. The proportional recovery rule is an interesting concept which assumes that recovery of function follows a fundamental neurobiological process that cannot be influenced by whether a patient receives high or low intensity therapy. After 6 months, spontaneous recovery has limits and may lead to long-term deficit. However, with proper rehabilitation training, improvement of these deficits can be achieved. The path to recovery also depends on the location and size of the stroke. Studies have shown that motor and functional outcomes after stroke correlates with brain lesion profile. Function or area of body that takes larger space in the brain will take longer to recover. Our thumb has one of the largest representation in the brain, so it is always difficult to gain normal function of thumb. Systems related to gross activities such as moving the arm or your leg does not take too much space in the brain and thus recovers quickly. Similarly, activities like speech, attention, memory may take longer time to recover. As it was mentioned in the earlier section of this stroke rehabilitation video, our body tends to develop increase in muscle tone after brain stroke. Along with that, it also generates some basic limb synergy. Development of excess tone and limb synergies are considered as normal process of recovery, but persistence of both can lead to serious deficits. Pioneer of physiotherapy Signe Brunnstrom, a Swedish physiotherapist, had developed one of the most well-known stroke recovery stage in 1960s. These are known as Brunnstrom stages of stroke recovery or Brunnstrom approach. This approach describes the sequence of motor development and reorganization of the brain after stroke. Before understanding how these stages will appear and look like in a patient, it is essential to know what is the basic limb synergy. Normal synergistic movements are purposeful movements with maximum precision and minimum waste of energy. Like if I want to drink water from this glass, all my joint movements, direction of movement, application of force and coordination between various muscles would be planned in such a manner that a smooth action can be executed. Basic limb synergies are mass movement patterns resulting from multiple unwanted muscle contractions all happening at the same time. Basic limb synergies do not permit different combination of movements and movements are repetitive, primitive, automatic and reflexive. It is due to loss of inhibitory control from higher center. It is difficult to do daily activities with abnormal synergy as your limb begin to move involuntarily without you trying. So if a person with stroke wants to drink water from this glass, they will not be able to isolate movements in all the joints of upper limb, and this limb will move as one unit in a repetitive manner. So if I ask a patient with stroke to take this glass from my hand, they will first think how to take this glass, and when they try to reach towards it, first their shoulder girdle will elevate, then they'll have to turn their body to lean forward and reach the glass, as the shoulder, elbow and the wrist do not have isolated movement. Also, this simple movement will take lot of energy, and it is enough to make the patient tired. The Brunnstrom stages of recovery depends upon emergence and decline of these synergy patterns as well as muscle tone. It is also important to know that these recovery stages are not linear. That is, it does not always go from start to finish. It is very common for stroke survivor to get stuck in one of the stages, but understanding about these stages will help you to do the right thing at the right moment, and that will make a lot of difference in the outcome. So stage 1 is flaccidity. This stage usually occur in severe stroke, and patients with mild and moderate stroke may skip this stage. In this stage, the affected limb will be limp and feel heavy, and there will be no movement possible voluntarily or with external stimuli. Passive range of motion, controlled stretch and positioning helps to bring the patient out of this stage. In stage 2, tone increases and spasticity develops. In this stage, small amount of effort causes reflexive movement due to hyperactive reflex and inability of brain to stop the reflex. This stage is better than stage 1 because here patient can initiate the movement using abnormal synergy pattern, as brain is trying to form newer connections. It is always better to begin functional task at this stage, as the patient can quickly learn not to use the affected limb and develop learned non-use deficit. In stage 3, spasticity increases and get worse, and movements become highly limited and sometimes painful. However, at this stage, patient will have some control over the movement using synergy patterns, but will not be able to complete the movement. If the joints are not moved enough, the muscles become tight and hard. At this stage, stretching and exercises using functional patterns are useful. Use of splints to maintain the length of muscle is beneficial. Spasticity is highly sensitive to any external stimuli, even stress. So, at this stage, try to limit stress by doing deep breathing exercise. In stage 4, spasticity begin to reduce and patient will start to gain some control over the movement. This stage is best to gain proper movement patterns. Using the affected limbs for functional tasks will give proper idea for direction of movement. Use of various exercises strategies designed to retrain the lost movements are beneficial at this stage. Your physiotherapist will guide you through that. In stage 5, spasticity is minimal and more successful movements can be produced. More complex movements can be achieved. Finer tasks such as buttoning a shirt or holding a spoon can be possible. At this stage, the more you practice your functional exercises, more finer your movements will become. In stage 6, spasticity completely disappears and coordinated movements can be done. Some residual weaknesses can be seen at this stage that can be resolved with continuing strengthening exercises. Stage 7 is normal movement. In this stage, brain and your muscles communicate effectively and movement become near normal or normal as previously. Now, sometimes it may happen that recovery stops at one of these stages and no progress can be seen for a long period of time. This is called plateau. It means your recovery has reached a pause or a break in between, and this is the stage where most patient gets discouraged. So it is very essential to remember that neuroplasticity happens lifelong. There is a room for improvement even plateau is reached. Plateau essentially means time to change things over. So it is the time to re-evaluate and plan a new strategy of action. It has been seen that those who overcome plateau recovers more effectively. Recovery from stroke is a long journey with lots of ups and downs. There will be small successes and lot of failures. But those small successes are your reward. Here are some tips to consider when recovery appears to have stalled. Don't get discouraged because everyone's recovery is different. Neuroplasticity happens lifelong, so keep exercising and keep on learning. Use weak limb repeatedly as much as you can. Repetition is the key to avoid learned non-use of limb. Try to do your daily activities with affected limb first before getting help from the non-affected limb. Reduce your stress and anxiety by staying with friends and family that gives positive energy. And participate in social activities to get creative. If you have any question or suggestion about today's video, then please write in the comment section. If you like today's video, then don't forget to like, share and subscribe. See you next time. Bye-bye.